One person in 6 has a clinically significant hearing defect, yet this is one of the most misunderstood of disabilities. As a result, those who suffer from it have a constant fight to overcome the problems. Hence this program, which is in 2 parts. The first part is about deafness, and the second part describes the various aids to hearing. We start part 1 by describing sound and how we hear it. Then we show what can go wrong with the hearing system. And since many deaf people suffer from the additional handicap of noises in the head and ears, we've included a section on tinnitus. Finally, we describe the process of communication and how it's affected by hearing loss. First of all, sound. Those of us who have normal hearing hear sounds most of the time, although we only consciously listen to a small proportion of the sounds we hear. Sound is caused by something vibrating, such as a road drill, an aeroplane, a telephone, or the vocal cords when somebody is speaking. The vibrations are transmitted to the surrounding air particles, which are pushed forward. They, in turn, collide with their neighbors, forming a series of pressure waves known as sound waves in the air. Loud sounds cause bigger pressure changes and more powerful sound waves than quiet sounds. High-pitched sounds cause more frequent sound waves than low-pitched sounds. Young people can hear sounds ranging from 20 to 20,000 waves or cycles a second. Most sounds, including speech, consist of a complex mixture of high-pitched sounds and low-pitched sounds of varying loudness. The sound waves radiate out in all directions, rather like the ripples if you throw a stone into a pond. The waves become weaker and eventually die out. Now, if there's anything in the path of the sound waves, some of the vibrations are transferred to that, although where the surfaces are hard, most will be reflected. When the sound waves reach the ear, it translates them into neural messages, which the brain can interpret. The outer ear is shaped to act as a funnel, which channels the sound waves along the ear canal until they reach the eardrum. This is a membrane which is stretched across the ear canal and forms the entrance to the middle ear. The pressure of the vibrating air makes the eardrum vibrate, and it moves in and out at varying frequency and intensity depending on the pitch and loudness of the sound. On the other side of the eardrum is the middle ear, which is full of air. The eardrum is in contact with a tiny bone to which the varying vibrations are transferred. This in turn passes them on to the second little bone and then the third. The eardrum would not vibrate efficiently if the air pressure was not equal on both sides. For this reason, there's a passage between the middle ear and the back of the nose and throat called the eustachian tube, which opens when we yawn or swallow. This is why we feel a pop in our ears when we change altitude, as for example in an aeroplane. The third little bone rests on a membrane called the oval window, which also moves in time with the vibrations. The oval window is the entrance to the inner ear. The inner ear includes the semicircular canals which are concerned with balance and not with hearing. The vibrations of the oval window are transferred to the cochlea. This cutaway model of the cochlea shows that it's a coiled tube. It's full of fluid, and the passage is lined all the way along with thousands of tiny hair cells, as seen in these magnified photographs. The hair cells are nerve receptors. The vibrations are transferred to the fluid in the cochlea, which is set in motion. The movement of the fluid stimulates the hair cells. The movement of the fluid caused by high-pitched notes affects the hair cells at the base of the cochlea near the oval window, whilst the movement due to low-pitched sounds affects the hair cells at the apex. Loud sounds stimulate many hair cells, whilst quiet sounds only stimulate a few. The hair cells are attached to nerves which are linked with the main nerve of hearing, which goes to the brain. Different hair cells send different impulses along the auditory nerve, so that the brain receives a variety of signals according to the nature of the original sound. Provided it has sufficient information, the brain is able to decode the signals and recognize the original sound. We have an enormous range of hearing. A loud shout is about 100 million times stronger than the quietest sound we can hear. However, loud sounds can cause pain and even damage our hearing, because the ear is a very sensitive instrument. In fact, there are many things that can go wrong with the system, causing deafness. We'll consider these in the next part of the program.